Men's Health Month. Here with more on both men's health and boys' health and the Nurse Advice Hotline is registered nurses Laura Valdez and Danny Downs. I want to thank you ladies for joining us this morning.
Thank you.
So let's get right into it. You know, it's very important, and men sometimes they don't like to go to the doctors, right? They don't want to get those checkups, but you mentioned it's so important and crucial that they go to do these preventive checkups.
It really is. One of the biggest problems with men's health issues is it's usually lack of awareness. So we like to raise awareness so that they can take action on their health. So the most important thing that they can do is really establish with a primary care doctor and make that appointment for that annual checkup. Get those health screenings done. Know your numbers, know your cholesterol level, know your blood pressure, know what your blood sugar is. And make sure that if you're of a certain age, the doctor's going to recommend cancer screenings. It may be prostate cancer screening, colorectal. For the younger people, it may be skin cancer screenings and other things like that.
And despite a lot of men out there, they eat well, they exercise, but there still could be problems, underlying problems that you just don't know about, and that could really surface later on.
It really can. Men access preventive health less than half as often as women. They die twice as often from heart disease and 35% more often from cancer.
Wow.
And if some of these conditions are detected early and we can treat them, you can live with them and have a great, longer, healthier life and be happier.
So alarming, those numbers.
Yes.
Do men just feel that they don't need to go? What do you experience when you
a lot of men,
talk to some of the men?
they're busy. They have a lot on their plate. They're doing a lot of things, and so a lot of times they just don't make time, or they don't have a doctor. A lot of the men callers frequently tell us, well, they don't have a doctor, and so we really try and get them hooked up with the doctor and create a medical home for them to get the care that they need.
They're busy taking care of the family.
That's
taking care of other priorities.
Right.
And that's what makes, June Men's Health Month so important, because this is a reminder that you should go get checked.
Right, and it's
so
Father's
important.
Day, so even if you're not a father, everybody tell any man in your life, get checks.
Absolutely. You see, you girls are wearing blue ribbons here. What
We
does that
are,
mean?
and it's Wear Blue for Men's Health Month, and that's to increase awareness. We wear pink ribbons for the women, let's wear blue ones for the men and make sure they all get their care.
Sounds great. So let's talk about boys. We're talking about boys, they need to go in for the screenings as well, right, the checkups, but what do you see most often with boys when it comes to injuries or maybe their health?
I think that an important issue to think about is keeping up with their immunizations, making sure those kids get immunized. The second point that I would make is making sure they wear helmets. I get a lot of head calls, a lot of head trauma calls from mothers where kids have fallen off bikes or skateboards. They're not wearing a helmet. And it's crucial. It's those types of injuries that can cause problems later on.
Right.
I also recommend that any kid around the age of puberty, especially young men, start to establish that relationship with their provider, because as boys grow into men, it's this fear of the doctor thing that goes on. And I think it's important for kids to start at an early age feeling comfortable, whether it's a male or a female provider, and being able to go in and express what their symptoms are or what's significant to them.
And doctors and nurses, you guys are the ones that really we can go out there and we can talk to and we shouldn't feel insecure, because you're just there to help us.
Exactly, exactly. And I think men, I've noticed a trend in more male calls because it's quicker access to talk to us. They can remain anonymous. We can help them in the community find that venue they need. And so it's an amazing service for them.
Let's talk about the calls real fast. We have about a minute left. So we have a national hotline, is that correct? Or I guess
it's
a statewide hotline, rather, that they can call you guys. So say if they think they need to go to the ER, they can call you guys. And what happens?
For general information. And so a nurse will always answer 365 days a year, 24/7. We're always available. It is New Mexican nurses taking calls from New Mexican residents. And we're there to provide direction as far as where's the best resource for care, whether it's 911 or you can take care of it yourself at home.
And we were talking about this. I know that. How are you guys funded?
Well, that's one of the things. We're an extremely unique model. There's not another one like us in the country. We're private and public collaborative, where we have some public funds to help defray the costs of the uninsured. However, we have private partnerships through some of the larger provider groups, a few hospitals, and the insurance. And so we really need that private partnership to continue services for the people that access services in this state.
And because of your funding, that's why, like, let's say if I call and I have insurance and my insurance provider already has a nurse hotline, you guys will say, did you know your insurance had a nurse hotline?
Absolutely.
And kind of lead me where I need to go.
Right,
Absolutely.
and we are a wonderful resource in order to make sure that people have access to what they need at the most appropriate site, which may be with their own insurance nurse hotline.
Real fast, give me the number so we head up to break.
It's 1-877-725-2552.
Great. I want to thank you ladies both for joining
Thank
us.
you.
Thank you.
Men and boys out there, it is your month. Get out there and get screened. We'll be right back.